Hello, my name is Susan Marzolini, and for the next 20 minutes or so, I'll be talking to you about resistance training. By the end of the session, you'll understand the benefits and goals of resistance training, you'll know how to carry out your weight training program safely, and you'll know the basic terminology of resistance training. You'll also know how to fill in your diaries and keep your exercise logs. So why include resistance training into a cardiac rehab program? Well, we know that weight training is actually important for everyone because people will lose 30% of their muscle mass between the age of 20 to 80. And that's actually depicted on the slide in front of you. The solid symbols represent the average amount of muscle mass in men, and the open symbols represent the average amount of muscle mass in women. And on the horizontal axis, you'll see age. So as age increases, the amount of muscle mass gradually decreases. And depending on the person, the loss can be up to 30 to 40 pounds of muscle mass. And that has some fairly serious implications on health. So from research we know that this loss of muscle mass is associated with 35% of the reduction in fitness level that occurs as we get older. Also, loss of muscle mass is associated with reductions in strength and muscular endurance, and that can increase the risk of falls, ultimately leading to disability. Also, loss of muscle mass can result in a reduction in metabolism or resting metabolic rate. And that means that an individual would be using fewer calories or burning fewer calories even sitting at rest when they have less muscle mass. Also, as people get older, they become less active. So combined with the reduction in metabolism, this can lead to an increase in fat mass. So it's this reduction in muscle mass and the amount and the distribution of fat, which usually goes around the trunk area, which has the greatest cardiovascular risk. It's that combination that results in an increase in cardiovascular risk and an increase in type 2 diabetes. And a proven method from research we've done and others have done to reverse this loss of muscle mass is to do resistance training. And that's one of the reasons why all of the major health organizations now recommend that resistance training being included in all cardiac rehab programs. So in this next slide, I've combined 4 separate studies that have examined benefits of doing aerobic training, which is walking, jogging, cycling, swimming, or doing aerobic training combined with the resistance training. So in these studies, there were 20 to 40 men and women, all who had a history of heart disease, and they were either randomized to aerobic training or to aerobic training plus resistance training. And they would do these programs for between 12 and 24 weeks. The results were that the people that did the combined training, the aerobic training and resistance training, had an improvement in their fitness level of 18%, while the people doing aerobic training only improved 11%. In terms of body composition, the combined training program group had a fat mass loss of 4 pounds, and their muscle mass increased by 3 pounds on average, while the aerobic training only group had no significant changes in their body composition. And as an aside, 75% of the fat mass that was lost in the combined training group came from the trunk area. And in terms of quality of life and confidence, combined training groups showed improvements in those parameters, while the aerobic training group did not. Other benefits include increases in strength, up to 50% increase in strength, which can make activities of daily living and work easier. So it would make lifting grandchildren or children easier, carrying your groceries, and also for recreational activities such as golf, tennis, any recreational activity, it can make it easier and actually safer. Weight training also enhances self-image and confidence, can prolong independent living, and it can delay and prevent osteoporosis, which is a condition that can happen as we get older. The bones become more brittle, they're more likely to fracture. But resistance training not only improves the strength of the muscle, it also improves the strength of the bones. Weight training also strengthens connective tissue and the muscles around the joint, so it stabilizes the joints and it helps to prevent injuries. And for people who have diabetes and pre-diabetes, resistance training, it has even greater importance because it helps to control blood sugars. Muscle is the biggest utilizer of blood glucose in the body. The more muscle you have, the better control of your blood sugars you'll have. Now, we know from a lot of research that's been done in the past that weight training is very safe for people who have a history of heart disease. So if you've had bypass surgery, heart attack, a stent, or an angioplasty, weight training is very safe. However, there are a few contraindications to participating in weight training. So if you have a hernia, and not a hiatus hernia, but an umbilical hernia or an inguinal hernia, an abdominal hernia, it may not be safe for you to do resistance training. So you need to let your cardiac rehab supervisor know about that. If you have eye complications such as retinopathy that's related to diabetes, again, you need to let us know. If your blood pressure isn't in good control, so if the systolic blood pressure, which is the top number of your blood pressure, is greater than 160 millimeters of mercury, if your diastolic pressure, the bottom number, is greater than 100, then you're not ready to do weight training. We'll wait till your blood pressure is a little more stable, and then we'll start you off with the weight training. We need to know if you have difficulties getting up from the floor, if you have any joint problems, or anything that might interfere with weight training. Let us know so that we can modify your program to make it safer and more enjoyable for you. You will continue with your aerobic training exercise 5 days a week, and you'll be adding in resistance training, which you will do 2 times a week. So you can do your resistance training on the rest days from your aerobic training, or some people like to do them together. It depends on how you feel. If you feel a little fatigued doing your aerobic training and your resistance training at the same time, then you might want to break it up. Do it at a different time of day, or do your weight training on your rest days from your aerobic training. Few terms that you will need to know are repetition, and one single repetition or one performance of a selected exercise is considered a repetition. So for example, with this bicep curl, I lift the weight up and lower it down, and that's 1 repetition. A set is a specified number of repetitions. We will be prescribing to you at the beginning of the program 10 repetitions of each exercise. 10 repetitions will be 1 set. A circuit is a series of selected exercises, so you'll do 1 set of each exercise, make your way down to the last exercise. Once you finish that, you've completed a circuit. Now, the goals of the weight training program are to achieve a balance between muscular strength and muscular endurance. The definition of muscular strength is the maximal amount of weight a person can lift 1 time. Muscular endurance is related to repetition, so it's the maximal number of repetitions you can do of a specified weight. They're both important, and we want to get a balance between the two. We don't advocate working on just muscular strength. That's the type of program a bodybuilder would do. You would need to lift weights, very heavy weights, only a few number of times. And lifting heavy weights is not safe for cardiac patients. It increases the pressure in the cavity where the heart sits, and it puts more stress on the heart. It's also not practical to do that type of program because a lot of activities of daily living require repetition. So we want to also improve muscular endurance. Now, in order to improve endurance and strength, we need to follow the overload principle. That's gradually overloading the muscle, so you make the muscle work harder. So we're going to start you off at a specific weight to lift for each exercise, and each exercise may have a different weight, and we will gradually increase the weight that you're lifting, and that will improve your strength as well as the amount of muscle mass that you have. And we will also be increasing the number of repetitions that you're doing, and that will increase your muscular endurance. So from the research that we've done and research others have done, we know that 10 to 15 repetitions at a moderate weight is safe and will improve both muscular strength and muscular endurance. You'll also have an increase in muscle mass, which, as I've mentioned before, is very important. Now, just to let you know, you may feel some muscle stiffness and soreness that can occur several hours and last even 3 to 4 days after weight training, especially if you haven't been using your muscles very much. And the reason this occurs is that when you weight train, you're breaking down the tiny muscle fibers in your muscle. And it takes around 24 to 48 hours for those muscle fibers to repair themselves, and that's how the muscle gets bigger and you get stronger. So you may feel a little bit of discomfort, but in order to prevent the discomfort from being too much, you need to warm up and cool down. So 5 minutes of walking or stationary cycling, and also stretch the muscles before and after you do your workout. But you might find when you do your second weight training workout, it actually makes your muscles feel better. If you do, however, feel some localized pain in the joints, or if the muscle stiffness and soreness is more than you're comfortable with, discontinue the weight training and let your rehab supervisor know. In terms of workout routine and safety, as I mentioned, you always need to do a cardiovascular warm-up and a cool down, including your stretches. Perform the exercises with proper technique. The most common cause of injury is lifting the weights with incorrect technique or lifting more weight than you're capable of. So it might be a good idea to stand in front of a mirror when you're doing your exercises. We're also going to give you a package with pictures of the exercises and a written explanation of how to do each exercise. Never hold your breath when you're lifting weights, because that increases the pressure in the cavity where the heart sits, puts more stress on the heart. Don't ever exceed an RPE of 15. That's hard work. So what we're going to do on your first session, we'll estimate a weight we think you can lift 10 times comfortably. That last repetition should not feel any greater than 15. So it shouldn't feel more than hard work. It should feel like you could do 2 more repetitions, but not 5 or 10 more repetitions. So at any time, if it starts to feel like it's more than hard work, just stop lifting that weight. It's probably a little bit too heavy. Always take 30 seconds rest between sets, and that allows the heart rate and blood pressure to come down. And always cool down and stretch after each session. And I've mentioned this before, but you always need to take that rest day in between your workouts. So never lift weights on 2 consecutive days. You always have that one rest day, and that allows the muscle fibers to repair themselves. So these are the 10 exercises that we prescribe. We actually have 2 different programs. This is our basic program, and for people who have difficulties getting up from a lying position, we have an alternative program for you. So we need to know if that is a problem, and we'll prescribe our alternative program to you. So with these exercises, we're working all of the major muscle groups of the body, and they require a certain amount of balance and coordination, which is why we use the handheld dumbbells rather than the fixed weight machines, because they require that balance and coordination that has a greater carryover to activities of daily living. Now this is the diary that we will have you fill out. Kesteri has already gone over the top part of the diary, which is where you fill in your aerobic training information. The bottom part of the diary is for the resistance training. And as you can see on the far left-hand side, we have the specific names of the exercises. So there's 10 exercises in our basic program. And the next column over, it says WT. That's we would like you to fill in the amount of weight that you lifted. And I've put an example there on the third exercise, the bicep curl. And in this case, this person has lifted 5 pounds. Next column is rep or repetition, where you fill in the number of repetitions you did. This individual lifted 10 repetitions. And then the next column is the RPE, rating of perceived exertion. That scale is actually on the diary. And you fill in how the last repetition of that set felt. So if it was a 13, 14, remember if it's above 15, the weight's too heavy. And then the following 5 exercises are on the right hand side of the diary. Now in terms of weights, the actual equipment, after your first resistance training session here, we will loan you the weights, and you take them home, you practice with the weights, and then you bring them back on the second session. On the second session, we're going to fine-tune your exercise prescription. We're going to do a test where we find the heaviest weight you can lift one time for each exercise. We take 60% of that weight. That's the weight you should be able to lift 10 times comfortably, and will build muscle mass and improve muscular strength and endurance. So after that second session, we can sell you the weights here, or you can purchase weights at another fitness facility. When you're ready to increase your weight, so you're ready to progress on, you can bring in the weights that you no longer need, trade them in for the heavier weight, and just pay the difference. Now the next two short sections, that'll take about 5 minutes, I'm going to be talking about progressing your resistance training program, and I'm going to talk about some of the barriers you might encounter when you're doing your weight training program. These are things you might want to come back to in the next 2 or 3 weeks. This is when you'll need to apply these principles. So I'll go over them, but remember, you can always come back at a later date. So why progress? Well, it's really important to gradually, as I mentioned, overload the muscles so you will continue to get improvements. Just like the aerobic training, you're prescribed a mile or a half mile when you start here, but you're not left at that level. You're gradually progressed. And that's essential in order to see improvements. It also helps keep you motivated and adds a bit of variety to your program. So when we first start you out here on your first session, you'll be performing 1 circuit of all the exercises. Second week, we fine-tune the weight that you're lifting. Third week, we're going to have you perform 2 circuits of all the exercises. So you go through all of the exercises once. Remember, 10 repetitions or 1 set of each exercise. Go down to the 10th exercise. Then you're going to start the whole thing again. Go up to the top and do them all again. That's 2 circuits. Once you're comfortable with 2 circuits, you'll gradually start to increase the number of repetitions. So you'll be going from 10 repetitions gradually up to 15 repetitions, and that might take 2 or 3 weeks. You just do that as you feel comfortable. Once you can do 2 circuits of 15 repetitions comfortably, so it doesn't feel really hard or you're not struggling and straining to lift that last repetition, then you're ready to increase the weight by 2 or 5 pounds or whatever the next weight up is, and you drop down to 10 repetitions. Now this is all written in the package that you're taking home. So this next slide is in your package, and it just gives you an example of how you might progress. Remember, everybody's a little bit different, so you might progress at different rates. And also I should mention that with the TheraBands, you follow the same progression, but you go from a yellow to a red to a green, blue, and black. And so the Dynabands actually get a little bit thicker and harder to use. So just quickly, we conducted a study here where we surveyed over 500 people who had lifted weights for about 7 years from our program, and we wanted to find out what the barriers were to continuing with a resistance training program. And in fact, what we found was that the compliance was very high. People continued with their weight training, they really liked it, and they found that it was very beneficial. But the people who did discontinue their weights, the number one reason was lack of motivation. So our suggestions are to keep your resistance training logs, keep filling those out. That might help keep you motivated. And also what we found with our study was that the people who didn't progress with their exercise, they didn't increase the weight or increase the repetitions, they were more likely to drop out. They wouldn't have felt the benefits of resistance training. They wouldn't have increased the muscle, decreased the fat. So you need to move forward with the program. Go back to the beginning of the video, review the benefits. That will help keep you motivated. And also you need to have realistic expectations. We found that people who wanted to lift weights just so that they would lose weight were more likely to drop out. We speculate the reason was when they measured their weight on the scale, their weight didn't actually change, and it probably won't, because as I mentioned before, you'll probably lose maybe 4 pounds of fat and you'll gain 3 pounds of muscle. So your weight only might change by a pound, but your body composition has changed a lot, and that's more important than absolute weight. So have that expectation. You'll feel more toned, your waist circumference will be smaller, you'll feel better. Those are the important things. Second barrier was that people said they didn't have enough time. So you can do one set. You can stay with one set. You can do that twice a week. It'll only take you 20 minutes for each session that you're doing. So it's 40 minutes a week. If you can fit that in, you will still get benefit. But you'll optimize the benefit doing 2 sets a week. Also, if you have a period of maybe up to 3 months where you go away or you're very busy at work, then if you can manage to do 1 workout a week, then you'll maintain everything that you've built up over the previous weeks. But that effect only lasts 3 months. Then after that 3 months, you have to get back to your regular routine. Third barrier was that people felt that they were too lazy, and that's probably related to motivation. Fourth barrier was that people found weight training boring, these people that dropped out. And in fact, it can be boring. It's not like walking outside where you have a change of environment. So we found that people who joined a fitness club were more likely to comply with the program. There's a wider range of exercises, there are other people there, and you actually plan ahead of time when you're going to do your workouts. You could work out with a friend, work out to music, put your iPod on or your Walkman, and also it's good to change up the exercises. So let us know if you're getting bored, we can change the exercises for you. Finally, the fifth reason was that people felt they were too fatigued by work and other activities. So as I mentioned before, you can choose the amount of weight training that you think you can manage. So maybe 1 set twice a week, or for a short period of time, once a week for 3 months. Also, what you could do is do half of the exercises, so you could do 5 exercises one day and 5 exercises the very next day. As long as they're not the same exercises, it's okay to do that. So it would take you maybe 20 minutes each time. And finally, as I mentioned before also, you can do your resistance training on your aerobic training rest day, so you won't feel so fatigued. And the top 5 barriers for women were the same as what I've just presented to you, except the 5th barrier was family obligations, so instead of being too fatigued. So again, that's a time constraint, so follow the principles that I've mentioned about time. So that's all I have to present today. Please feel free to let us know if you have any questions. Talk to your rehab supervisor, but stick with it. You will feel the benefits. If you can stick with it for the first 12 weeks, that's when the muscles start to get bigger and you'll really feel the benefits. So good luck with your program.